the tech has already got your vitals, so what I'm gonna do is a head-to-toe assessment. Okay, so I'm gonna wash my hands first, okay? Okay. So your ID birth set. Can you tell me your name and your date of birth?
Elena James, 06-2595.
Okay, thank you. Okay, first we're gonna start out with your head. I'm just gonna palpate for any depressions or abnormalities. Also visibly check for any lesions or infestations, which everything looks good. Okay, the next thing I'm gonna do is I'm gonna palpate your sinuses. I'm gonna start with your frontal. Just let me know if there's any tenderness. Also your maxillary. Everything look okay. Okay. The next thing I'm going to do is move to your ears, and I'm just going to palpate your external ear and make sure there's no tenderness or lesions, which I don't see any. Okay. I'm also going to inspect the internal ear and make sure there's no discharge, which I don't see any in here. And that looks good too. Okay. I'm going to inspect your eyes now. Your eyebrows and your eyes are symmetrical to your face. I am going to keep looking at me. I'm going to shine my light in your eye. Okay. Also, I'm going to pull down on your eyelids, and if you'll look up for me, your conjunctiva is pink and moist, and I'm going to pull up on your eyelid, and your sclera is white and moist, which is normal. Okay, the next thing I'm going to do is check for accommodation. So I want you to look at my pen light and look at the picture on the wall. Back at my pen light. Back at the picture. Back. Okay, your pupils are equal and round, react to light, and accommodate. So that's normal. The next thing I'm going to do is palpate your nose. Make sure there's no tenderness or abnormalities, and it is symmetrical with your face. Okay, if you'll tilt your head back a little for me, and we're going to inspect the inside of your nose. And your mucous membranes are pink and moist. There's no sign of deviated septum. Can you flare your nostrils for me, please? Okay, your nostrils flare symmetrically. Also, I'm going to check the patency of your nostrils, okay? So I'm going to press one closed and breathe in. Okay, there's no blockage, so that sounds good. The next thing I'm going to move to is your mouth, which from the outside I can tell that your lips are pink and moist. There's no cracks, so that's you're not dehydrated. Okay, can you open your mouth for me? Okay, and move your tongue side to side, please. Up and down, and say ah. Okay, your mucous membranes are pink and moist with no lesions or bleeding. Your tongue is pink and moist with no lesions also. Your teeth are straight and white. Your hard palate and soft palate are both pink and moist. And your uvula and tonsils are intact and symmetrical with your throat. So the next thing I'm going to do is move on to your throat. And I'm just making sure that it is midline to your body. Also, I'm going to palpate your lymph nodes and make sure there's no visible masses or enlargements. And that sounds good, or that seems to be good. The next thing I'm going to do is I'm going to check your carotid artery. And I'm going to use the bell of my stethoscope. So if you'll just lean your head this way. Okay, and what I was checking for was any bruise, which is a swishing sound that can indicate a stenosis or occlusion, which is a blockage or narrowing of the artery, which that was fine. The next thing I'm going to do is I'm going to move to your anterior thorax. So I'm going to inspect and palpate. Just checking the temperature, making sure there's no moisture, and that your skin is uniform with the rest of your skin on your body, and it is. The next thing I'm going to do is place my hands on your shoulders, and if you'll just take a deep breath for me. Okay. And your lungs do can expand symmetrically and and I don't see any use of your accessory muscles. So what I'm gonna do is I'm gonna take a listen to, I'm also take your lung sounds, 5 spots on each of your lungs. I didn't hear any wheezing or crackling, which is a good sign that your lungs sound clear. The next thing I want to talk to you about is monthly breast exams. Do you do those? No? Okay. Well, the first thing is that they do recommend women to have a monthly breast exam, usually at the beginning of the month. One thing you could do is in the shower, which usually seems easiest for women. One thing maybe you want to do is stand in front of a mirror. You want to put your hands on your hips and kind of fold them like this, and look for any like dimpling, redness, scaling of the skin, anything that looks abnormal to you. Also, if you want to put your hands behind your head and kind of bring your elbows forward, and also look for those same signs, any scaling, redness, or any lumps or anything like that. Also, when you're in the shower, you'll put your head, one hand behind your head, and with your opposite hand, you'll start in your axillary region, which is your underarm. There are lymph nodes there. So you'll just start and kind of go counterclockwise around your breast until you get to the areola, which you'll gently squeeze. If there's any discharge, you'll want to notify your physician of that, so they can assess that further. Okay. The next thing I'm going to do is I'm going to palpate your thorax again for any visible pulsations. That seems good. I'm going to listen to 5 valves on the 5 valves on your heart, which your heart is located in between your second and fifth intercostal space. So I'm going to start with your aortic valve, and it's left of your sternum in the second intercostal space. Your pulmonic is on the left of the sternum in the second intercostal space. The Erb's point, third intercostal space. Tricuspid valve in the fourth intercostal space, and the mitral valve in the fifth intercostal space, in which this is also your maximum point of impulse, which is your apical pulse. Okay, and that's just left of the midclavicular line. And that all sounded good. I didn't hear any bruise or anything like that, so that sounded good. Next, I'm going to move to your posterior thorax. So yeah, you'll just turn for me a little bit. And just continue to breathe normally. I'm going to check about 9 spots in each of your lungs, okay? That all sounds good. I didn't hear any wheezing or crackling. Okay, the next thing I'm going to do is check your upper extremities, and we're just going to look for consistency in skin color, make sure that your temperature is consistent with the rest of your body. There's no moisture. I'm also looking for a skin turgor, which that's normal. If it wasn't normal, it would stay tinted like that. Also, I'm going to be checking your brachial pulse, and that is bilaterally symmetrical. Also, your radial pulse, which is bilaterally symmetrical. Also, I'm going to check your fingers for any clubbing, and also your capillary reflow, which should be less than 3 seconds, and it is, so that's good. Okay. The next thing I'm going to have you do is go ahead and just follow my movements to check your range of motion, okay? So first I'm going to have you do this, just flexion, quadrants of your abdomen. This is your right upper quadrant, your right lower quadrant, your left upper quadrant, and your left lower quadrant. Okay, so I'm just going to listen with my stethoscope. It can take up to 5 minutes to hear any bell sounds. Okay, and your bell sounds, they're not rushed or loud, so they're not hypertensive, and they're not low or absent, so they're not hypertensive. Okay, the next thing I'm going to do is palpate each 4 of your quadrants. Just let me know if there's any tenderness, okay? I'm going to feel it around your liver, also your spleen, and your kidneys. Okay, and that all seems normal, no tenderness. Okay, the next thing I'm going to do is move to your lower extremities. I'm just checking your skin again for temperature, uniformity in color, any abnormalities, lesions, or any other abnormal signs. Okay, so I'm going to move down and check your dorsalis pedis pulse, which is bilaterally symmetrical. Also your dorsalis, or your posterior tibial pulse, which both are bilaterally symmetrical. Also I'm checking for clubbing or your capillary refill, which is less than 3, so that's good. Okay, I'm also going to check your range of motion while you're lying down. Okay, so I'm going to pull your knee up. That's flexion, extension, abduction, and adduction. Okay, so that's good. If you'll go ahead and sit up for me, we're going to check. I'll just swing your legs this way. Okay. We're going to check the strength of your joints. Yeah. So when I push on your legs, you just push back. Okay. Okay. All right, and that looks good. Okay, so this completes your head to toe assessment today. Do you have any questions?
No.
No? Okay, you're welcome to get dressed and put your shoes back on. Did you need any help with that?
No.
Okay. All right, well, if you need any help, my name's Paula. You can give me a call. Your call late's located right here. So if there's any more questions, I'm done. Okay? All right, thank you.